If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. In this latest episode, we talk with Dr. Sophia Yen of Pandia Health. Pandia Health makes women's lives easier by providing a one-stop shop for recurring medications, starting with birth control. From affordable telehealth to prescription fulfillment and medicine delivery, Pandia Health is building the One Health brand women trust. In this episode, we talk about the inner workings of building a digital pharmacy around birth control, encouraging birth control tourism to improve access, navigating state-by-state laws, and the impact on clinicians on providing standard of care post Roe v. Wade. Let's get started.
So let's jump right into it. And let's start from the beginning. So tell me a little bit about yourself. How did you get started in entrepreneurship? And have you always wanted to be an entrepreneur?
I think entrepreneurship runs in my blood, in that my grandparents had their own company, my parents had their own company, and I started off as a doctor and still am a doctor, but started this company because I was giving a talk to a bunch of doctors on prescribing birth control, and a statistic came up: why don't women take their birth control? And one of the top reasons was because they didn't have it in their hand. And it was just the beginning of Etsy and eBay and stuff coming in the mail. And so my friend and I looked at each other like, well, yeah, let's just ship women birth control, keep shipping it to them until they tell us to stop. And then we ran ads, free birth control delivery. 60% of the women that responded to such an ad didn't have a prescription. And I'm a doctor, I can write prescriptions, and thus Pandia Health is born. If you have a prescription, just tell us where it's at. We'll move it to our pharmacy, bill your insurance or your credit card, set it and forget it, never run out of birth control on our watch. And if you need a prescription, then for just $20 once a year, you can use our expert birth control doctors who are passionate about women's reproductive health. They'll review your health questionnaire. You give us a blood pressure from the past year. Everything looks good, write the prescription, send it to our partner pharmacy, bill your insurance, or bill your credit card for the medications, whatever you decide. So that's, and also in high school, I did Future Business Leaders of America, which is a club. And I also did Junior Achievement, where you open your own company, issue stock, sell stock, and then pay back your stockholders. So that was a very, very cool experience as well.
That's awesome. So it sounds like on one hand, you're very familiar with entrepreneurship because you were raised in that environment. And then you saw a problem in your work environment when a question was raised around why aren't women taking their birth control, and you wanted to do something about it and make that process a little bit more seamless. And so that makes a lot of sense. And I think, given the recent climate, given the overturning of Roe v. Wade, access to birth control or alternative methods have the demand has increased. Let's just say that, right?
Absolutely.
I'm hearing a lot of things, from wanting access to birth control to wanting to get your tubes tied. Folks who know that they already don't want to have children want these options, and they're running into barriers because previously, if you're under a certain age or if you haven't been married yet, a lot of physicians are concerned with them potentially regretting it. And so I know that there's a lot of folks out there that are trying to figure out what their healthcare options are. And I'm curious, since the overturning of Roe v. Wade, has this affected Pandia Health's business or your business model, or how you're reaching your customers? Or your providers, right? Your peers, the colleagues that are working with you.
Yeah, no, this has absolutely increased website traffic, increase customers. We were at X, on June 23rd, and on June 24th, the day of the announcement of the reversal of Roe v. Wade, will be forever etched in my brain. Our customers went up to 3X. And we saw a slight decline over July 4th weekend. We feel people are probably out partying or something. And then it resumed. And part of it is also our marketing efforts have maybe picked up, solidified, done better. But I really do think that anybody with a uterus who is at risk of being impregnated willingly or unwillingly or contraceptive failure is really, getting on top of preventing any unplanned pregnancies. And we're seeing it both for people who are trying to access abortion, and that's after you're pregnant. But I like and I appreciate the people that are preventing it. And part of Pandia Health's thought leadership to increase access, particularly in more conservative circles and younger circles, is I'm an adolescent medicine specialist. So I specialize in teenagers. I doubled my training from pediatrics into adolescent medicine, what we call sex, drugs, rock and roll, little acne, some sports medicine. And the thought leadership is #periods optional. So if you go to pandiahealth.com/periods optional, you can see my TEDx talk on anybody with a uterus that's bleeding 1 week out of 4 that doesn't want to bleed. You can use any hormonal birth control, not for birth control, but simply to level the playing ground. So the example I give, pre-med biochemistry final at MIT. All of a sudden, blood everywhere, not everywhere, but coming out, and you can feel it. And you're like, do I finish this exam or do I run to the bathroom? And the answer for all pre-meds is finish the exam. Was I a little distracted? Yes. I looked to my left, I looked to my right, 2 people without uteri, and they're like, do, 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 not a care in the world. And I realized in retrospect, 1 out of 4 people with uteri in that room that day was bleeding. And so that's a disadvantage. I have 2 daughters, and I want them to be on level playing ground with those without uteri. And my joke as a tiger Asian mom in Silicon Valley is my daughter is going to crush your daughter if your daughter has a 1 in 4 chance of bleeding, and my daughters have the option to make #periods optional. But that's just one benefit. And the other benefits that I cover in my TEDx talk is you decrease your risk of ovarian, endometrial, colorectal cancer. So taking birth control out of birth control, but for decreasing cancer, increasing participation in school and work. The number 1 cause of missed school and work for somebody with a uterus under the age of 25 is painful, heavy periods. So anybody with a uterus who's missing school or work, please see a doctor. Don't suck it up. Just because it runs in your family doesn't mean you have to suffer. We now have the technology to make your life better so you can function.
I love that. I love that. And, this is an overshare here, but I'm definitely one of those that has debilitating cramps, and I'm sitting there trying to make it through the work day, going off a Zoom camera because I'm wincing in my face sometimes. I love the fact that you're taking birth control out of birth control and focusing on the fact that you're just trying to also stop the period flow. And there's a host of other things that just came to mind also as a non-binary person, sometimes, it's just annoying.
Exactly. No, my lesbian friends are like, what? I can turn my periods off? And I was like, yes. And my thing is, sex is better without blood, though some people like the lubrication. But I'm just like, blood's trying to come out and you're trying to pump stuff in. It's like contradictory to the plumbing, but to each their own. But if you don't want to bleed every single month, then we are here to give you that option.
That's great to hear. Yeah. And it's something that I think we don't talk about enough. People don't talk about periods in normal conversations. And so there's a taboo to it as well. But I love that you're also a doctor to adolescents. And I'm going to speak from a personal experience. I'm originally from Baton Rouge, and the healthcare system there is not great. There's a lot of adolescent pregnancies, and I have to tell you from my own family experience and friends, it's the number 1 reason why my peers were dropping out of high school ending up pregnant, you sort of, perpetuating the poverty cycle, and it's very hard to escape. And
Yes.
so there is power also in being able to provide birth control to adolescents, or those who would be highly disadvantaged should they have a child at a young age, especially those that are in sort of inequitable situations to begin with. And so there's a level of health equity too that I think you guys are touching on by increasing the access to birth control and preventing unwanted pregnancies there as well.
Exactly. And so, I like to say we bring expert care, academic, MIT, UCSF, Stanford quality to wherever you have internet and a mailbox. We can deliver to all 50 states. We currently can write the prescription in 14, but we're expanding as we're getting more funding. And we also encourage birth control tourism. So specifically, right now we're in Georgia, we're in Florida, but we're not in Louisiana or Northern or Southern Carolina. And but if you can get to one of the states that we can prescribe, you just fill out the questionnaire, give us a blood pressure from the past 365 days. And as long as you say, I am in Florida, Georgia, Texas, Pennsylvania, Illinois, New York, one of our 14 states, California, Arizona, Nevada, then we can then write the prescription and then we can send it to all 50 states. And it's less than 50 cents a day for most birth control pills. There is an even cheaper option, but my new hashtag is hashtag get the good stuff. So if it were me, my friend, my patient, my customer with a uterus, if you're a Caucasian female that wants to bleed every day, the really cheap pill works fine. But if you're Asian, Black, don't want to bleed every month, sorry, not every single day, every month, then unfortunately the $15 per pack is your option.
When you said that, the tourism, I want to stay on that for a little bit because I haven't thought about Pandia in that way. And it really makes me now rethink potentially, who are your customer base?
Mm-hmm.
So if folks can travel to states that you can prescribe birth control to, or they are living in states that can where you can prescribe birth control to, talk to me a little bit about sort of the ideal customer that you're trying to reach, or the type of customers who could benefit the most then from Pandia Health. It sounds like those who can travel have options, those who are in state have options. Can you walk me through that process a little bit?
Yeah, so we envision Pandia as being the online health brand women or people with uteri can trust, because we are the only women-founded and women-led, the only doctor-led company in this space. And we do want to serve everyone in every state. The ideal customer is anybody with a uterus who wants to either make hashtag periods optional or wants to prevent unplanned pregnancies. And because I'm an adolescent medicine specialist, we've made our platform adolescent friendly and following the adolescent laws across the state. The example is California. Anyone of any age has the right to consent to the prevention, treatment, and diagnosis of pregnancy. And so if you come on our platform and we say, hey, are you using this to prevent unplanned pregnancy? Are you using this to treat zits? Are you using this to treat heavy periods or a combination thereof? If you say that you're here to prevent unplanned pregnancy, then we don't need parental consent. However, if you're coming for acne or heavy periods, then we do need parental consent. Florida and Texas being very conservative states, we require parental consent for any minor because we don't want to get sued. We don't want our doctors to lose their licenses. And we thought that there would be a rural, urban split in our customer interest, but we're actually seeing equal interest from urban and rural. Part of it, I think, is because who has time to run the pharmacy every single month to get their birth control? And that's really why we started this company. Set it and forget it. You have better things to do. It should just come in the mail, automated, never have to worry about running out on our watch. The rural side, I think, is because maybe more conservative areas and are afraid to use it, though we bring care, convenience, and confidentiality. It comes in the mail. It's a nondescript package. For all you know, it could be eBay, it could be Etsy, it could be whatever, right? And so we also have the hashtag periods optional to make it more palatable to parents, as well as just, in general, a different way to look at it. No longer is it birth control, but it's hormonal treatment. It's leveling the playing ground.
That's great. So you're essentially building towards a digital pharmacy company for adolescents or for those that have uteri, in one light. And I see the need for that. And I'm sure you're aware that that category is highly competitive, growing a lot. And it's differentiating based on who's being served and what those medications are and how it's getting to the consumer. So that's great. And I think it's going to be definitely needed now, even outside of the overturning of Roe v. Wade. Getting access to medication, especially in rural areas, has always been a problem. And, probably more in urban areas, an optionality of convenience, but definitely needed overall, I think, in the healthcare system and reducing the barriers to access to medication. And that's truly amazing and awesome. One thing you said earlier around, trying to make sure that you're following the laws in each state. I know that has become a big burden in the digital health ecosystem as companies are building and expanding state by state. And given the ambiguous, I don't even know how to say this, given the ambiguous state of Roe v. Wade and the penalties for it, how do you think that's affecting companies like your own and Pandia Health and the way providers are thinking about how to care for their patients?
I think it is scary when politicians think that they're gynecologists. So there's a hashtag no gynoticians, which is a politician who thinks they're a gynecologist, because they'll pass these laws and they don't realize the health consequences. I didn't go to law school. I don't try to meddle in your business. You didn't go to medical school. You haven't taken care of patients. Please don't try to meddle in my business unless you got to medical school. And even then, do not try to push your religious view on another person, because that's just downright un-American. A basic tenet of the USA is freedom of religion. And so where it becomes dangerous specifically is some places are defining that life begins when the egg and sperm hooks up, and that if you do anything to interfere once that happens, then you are causing an abortion. That is not the medical definition of pregnancy, nor is that the medical definition of abortion. And it becomes dangerous with respect to miscarriage. It becomes dangerous with respect to ectopic pregnancy. So I think everyone has learned, hopefully by now in the news, but if you get an ectopic pregnancy, a pregnancy in your tubes, that there's no way that can survive to ever being birthed. It will blow up in the tube, and if you don't catch it, the person with the tubes will die. And there have been lawyers advising doctors in Missouri that you have to wait until you see that woman's heart rate drop, heart rate skyrocket, blood pressure drop, or signs of infection, that she will immediately die before you can take action. And that is not standard of care. If you are coming to California or anywhere that doesn't have these religiously bound laws or these gynoticians taking over, we will help you terminate an ectopic pregnancy as soon as it's diagnosed. Because to wait until your heart rate drops, heart rate skyrockets, or your blood pressure drops is dangerous, too late. And there's also been cases of women who had to be transfused several times, had to be put on a ventilator because they had to wait until the quote heartbeat stopped. But know that, this heartbeat stuff is not heartbeat. It's actually an electrical pulse. It's not your standard heart, and it's not a heartbeat. But again, there are these non-doctors, non-scientists meddling in medicine. So it is absolutely stressful to physicians, and physicians shouldn't have to risk going to jail, losing their job, losing their right to vote, because they're here to help someone. And you shouldn't expect the doctors to do so. I absolutely am in awe of my colleagues that are taking on that risk, but I'm not willing to die. I'm not willing to lose my job and risk my whole financial future to do this kinds of stuff. There are doctors who are, but we really shouldn't ask that of them.
We shouldn't have to at all. And the fact that doctors are in this position, again, I think it highlights some of the strain that is unseen but highly felt on healthcare workers, and the burden that, we often have to carry in order to give just basic standard care, if anything, great standard of care, to patients out there. I'm a parent myself. I have a young daughter, and even though I'm non-binary and I don't plan on carrying a child, um, I do have I do have a uteri.
Yeah.
My wife and I had to go through IVF, several rounds for us to create a family.
Wow.
We did have, embryos on ice, as we like to say, or we like to say, in order to create our family. And, thinking about what that would look like now in this space is very threatening to us, as
Yeah.
well as what it's going to look like potentially for my daughter and where she may be able to live or not live based on laws like these. And so I want to commend Pandia Health. I want to commend you, Dr. Yen, for all the things that you're doing. I can't wait to see your growth. Keep fighting the good fight. Keep up with the hashtags. I love them. Um,
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.